I'm Jo from Specialist Language Courses. We are OET premium preparation providers, which means we are experienced and skilled in what we do, helping people achieve success in the OET exam. In today's video, we're going to take a look at the strategies you can use for Listening C. All the materials we look at are available on our online course, Reach OETB, linked below. We're going to take a look at a brief overview of Listening C, how you can approach this part of the exam, and some study tips. There are 3 parts to the listening test. In this video, we are going to take a closer look at Part C. What is the exam format for Listening C? In Part C, there are 2 long presentations or interviews. Each extract will feature a healthcare professional talking about an aspect of their work. There will be 12 questions, 6 for each extract, and each one is a 3-option multiple choice question. The context of the conversation will always be provided. Here's an example. There are questions to guide you and 3 possible answers. For each question, mark your answer by colouring in the circle. For Listening C, you will need to understand large parts of the audio. Now let's take a look at some strategies you can use for this part. Before listening to each extract, you have 90 seconds. It's important to take advantage of this time by looking at the context provided so you can begin predicting what you may hear. Notice the structure of the audio and understand the questions. Read the options and notice the differences between them. Let's take a look at an example of how to do this. We can see the keywords here in the question. Why indicates that we need to listen for a reason and that we need to focus on the reasons given for male breast cancer, possibly as compared to female breast cancer, in terms of it not being given too much importance. If we look at the options, option A deals with diagnosis. For this answer to fully answer the question, it would have to give information about late diagnosis contributing to male breast cancer being a neglected disease. Option B states that because it's uncommon, it's not studied enough. For this answer to fully answer the question, it would have to give information about how male breast cancer is rare or uncommon, and that lack of studies contribute to it being a neglected disease. Option C states that older male patients with breast cancer are not treated with importance. For C, to fully answer the question, it would have to suggest that this contributes to it being a neglected disease. So now let's listen and choose the answer which best fits.
Why is male breast cancer referred to as a neglected disease?
Breast cancer in men is much less common than in women and remains an understudied illness. If we compare the statistics, it is easy to understand why there are fewer cases of male breast cancer to research. For example, the estimated risk of a man being diagnosed with breast cancer before the age of 85 is around 1 in 715, while the risk of a woman being diagnosed with breast cancer before the age of 85 is around 1 in 8. Each year, tens of thousands of new breast cancer cases are diagnosed, of which about 140 cases are of male breast cancer. Much of the information we have about male breast cancer comes from our understanding of female breast cancer, although it is clear that men react differently from women to a diagnosis of breast cancer.
The correct option is B. We can see in the audio script that breast cancer in men is much less common than in women and remains an understudied illness. It is then supported by statistics comparing the incidence of cancer in men compared to women, highlighting how common it is in men. It is then restated by confirming that the understanding of male breast cancer comes from information about female breast cancer, and this is the reason for it being a neglected disease. Option A is incorrect because we can see that the audio talks about the estimated risk of a man being diagnosed with breast cancer before the age of 85, but it does not mention in the audio at what stage of the disease they are diagnosed, early or late. We can see that option C is incorrect, and it is not mentioned in the audio. The audio does not talk about older men with breast cancer being neglected. Now let's look at another example. First, we need to understand the question. We need to listen for what Ms. Weston focuses on in terms of breast cancer research. For option A, Ms. Weston says that research is mainly about female breast cancer. Option B states that there is not sufficient research being done, and option C says that research does not focus on psychological areas. The correct answer will be which option Ms. Weston points out, focuses on, or highlights the most. Let's listen to the audio and choose the answer which best fits.
What is the scope of the male breast cancer problem?
I suppose it depends what you're talking about. If you are looking at the incidence of male breast cancer compared to female breast cancer, you are looking at quite small numbers. For example, in the UK, there are around 55,000 new breast cancer cases every year. However, cases of male breast cancer only make up about 370 of these cases. Male breast cancer is not in the top 20 cancers for men. Some studies suggest that male breast cancer survival rates are poorer than female breast cancer survival rates, but it can be difficult to judge. As I mentioned before, men tend to develop breast cancer at an older age, but they also tend to present themselves at their GPs at a later stage of the disease. Being aware of breast symptoms is another issue, especially for men who have not been targeted in breast cancer awareness campaigns, for obvious reasons. Because the cancer is relatively uncommon in men.
Option A says that it is predominantly about female breast cancer research. Ms. Weston states that the incidence of male breast cancer is low in comparison to female breast cancer and is not in the top 20 cancers for men. She then goes on to talk about survival rates, but states that it is hard to judge due to other factors. The answer is implied as the lack of research for male breast cancer is because it is more commonly about female breast cancer. So why is option B incorrect? In the audio script, we can see that it states some studies suggest that male survival rates are poorer, and it goes on to talk about other factors such as seeking medical advice at a later stage of the disease and awareness. But it does not state that not enough research is being done. And why is option C incorrect? Research is mentioned in the audio, but there is no mention of psychological factors, so therefore C is clearly incorrect. How can you prepare for listening part C? So it's important that you develop your listening skills for the OET exam. Only doing exam practice papers will not sufficiently prepare you for the exam. For listening C, you need to develop your ability to listen to longer talks and to keep your focus. Let's take a look at some activities you can do to help develop this skill. You can use things like TED Med Talks or podcasts such as BBC Inside Health. Practice listening to these longer talks and train your brain to stay focused. Listen to a variety of audios on a variety of healthcare topics. Listen out for the speaker's attitude and opinion, and practice dealing with unfamiliar content and vocabulary. Here are some specific tasks you can do in your self-study using resources such as TED Med. While you are listening, you can pause the talk every so often and summarise what you have heard, and then predict what you think you're going to hear next. Another useful practice is structuring and sequencing. Note down the main structure of the talk and then listen and take notes. It can be helpful to watch it another time to compare your notes and see if there is anything that you missed. You can then make a note of any expressions they use to organise their speech. You can also improve your vocabulary by noting down any unfamiliar words. It is a good idea to try and guess the meaning from the context before looking up the words and seeing if you were correct. This can be followed by writing some example sentences using the new words. Top tips for listening Part C. Notice the structure of the audio before you listen by reading through the questions. Underline the key words and stay focused. So thanks for watching. If you would like more strategies and tips on how to prepare, check out our website. You will also find handouts which you can download with everything we've talked about today. Link below. Please like and share so we can help more people achieve success in the OET exam. Don't forget to subscribe for more videos like this. Bye!